We're going to get started. If you could take your seats, because if you haven't already figured out, and as Catherine keeps saying, we have an extremely tight schedule, an enormous amount of information we're trying to cover. Since the Cook County PowerPoint is already up, we're going to now start with Cook and then go back to the city of Chicago. We were trying to lay a landscape of what do we know about what's happening in Chicago and Cook County, and now we're going to be turning to how are the city and county responding to the problem of lead poisoning and what is in place and what more needs to be put into place. So it's my pleasure to introduce LaTrice Porter Thomas, who is the Environmental Quality Manager at Cook County Department of Public Health. She's been there for the past 12 years, and she's responsible for overseeing the enforcement of the Illinois Lead Poisoning Prevention Act. And I will just add, having been working with LaTrice for many, many, many years, she is a wonderful go-to person who both has the knowledge and expertise and the willingness to really be responsive to questions. So thank you.
Well, thank you very much, Anita and Catherine, for inviting us to speak. I really appreciate it. Since like Anita said, since our presentation was up, I said, can we just go ahead and go first? Although that means that I don't get to benefit from, being able to say ditto to everything Kurt said and just abandon my presentation. So I'm going to talk about what we do in suburban Cook County. Gosh, you're getting feedback. Suburban Cook County, when we do receive a report of a child who has a blood lead level greater than 10. So in suburban Cook, we do have a multidisciplinary team that handle our lead poisoning prevention program. It's a collaboration of 3 units within our department: our environmental health services unit, our lead poisoning prevention unit, as well as our integrated health services, which is our nursing unit. So our environmental unit, basically our client is the home. So we are, performing the lead risk assessments, issuing mitigation notices, clearing the properties when they're remediated, and we work closely with a general contractor in administrating our lead poisoning prevention grant, which is actually done through the lead poisoning prevention unit. They are the ones who bring in our cases, who refer them out to both nursing and environmental. They do a lot of outreach and education in addition to managing that grant, and they also manage the contractor process and the bidding. And our nursing are the ones who do our case management of our children. And I'm going to go over these a little bit further. So as I stated, environmental health services, our client is the home. And for our nursing, their client is the child. So they are the ones who follow the kid. I am going to apologize for this slide. I know it is very busy, but it's the only way I could kind of really outline how this process goes. I'm going to walk you through this, so hopefully it makes a lot more sense by the end of the talk. So as Deanna mentioned, a referral is triggered when a child has a blood lead level of 10 or greater. And so that referral comes from our lead poisoning prevention unit. It is sent out to both environmental and nursing. And so once we receive that, it is assigned to a lead risk assessor. The lead risk assessor makes attempts to try and contact the guardian or the parent who is listed on the referral. I'm sorry. And so depending on the lead level, depends on the amount of time that it takes that they have to make that contact. So the higher the level, the less amount of time we expect them to make that contact with the child. But most of the times that contact is made within 1 to 2 days of the receipt of the referral. So once we schedule that inspection, so let's just go down to the left side of the screen. If we are not able to schedule the inspection, so the no. The lead risk assessor tries to make at least 3 phone attempts to get in contact with the family to try and schedule that inspection. At least 3 phone attempts, 2 home visits, we'll send letters, and sometimes, we also have to work with our nursing case management as well, because sometimes these kids are in our system as being seen already. So sometimes they will have a contact phone number that is different from the number we have, or sometimes they're being seen in our clinics on a date that's coming up. And so we've even had to go to the clinics and contact the families that way to get an inspection scheduled. But if none of that works, then there are two things, and I apologize because this is also, it says 2012. There have been some updates that have been made to this, but it is still pretty good. So we're either going to refer to the state's attorney's office if we know for sure that somebody lives there, the possibility that the kid lives there, the family is avoiding us, they just don't want to talk to us, they just don't want to allow us to make that inspection, then we have the ability to notify, we do have the ability to refer them to the state's attorney's office and say, look, we may need a warrant to get into the home. Or if we are making those contacts and the letters are coming back, we go out to the home, nobody is there, the property is vacant, we know that we're not going to find a person, we just have to unfortunately label it as a no contact, and if at some point in time we're able to make contact, then we can proceed on, but at the current time then it's just labeled as a no contact. We're just not able to find those families. So moving to the right side where there is a yes, that we have scheduled the inspection, the lead risk assessor will notify our nursing case manager and say, I've got the inspection scheduled, it's this day, this time, are you available? If the nurse is not available, then the nurse will make a separate home visit. We really try to stress as much as possible that the nurse and the inspector goes out on a joint visit. It lessens the burdens on the family, and it also helps to really show that we're making a collaborative effort here. It also helps our inspectors to be able to concentrate more on the home, and it allows the nurse to concentrate on the child. Because when we're not able to make those visits together, sometimes the inspector is having to talk to the mom, you know, and kind of do a little bit of that pressing on the client, on the nursing case management side. So, and then also too, our nurses we have several nurses who are bilingual. So it really helps the inspector who is not bilingual to talk to mom and the rest of the family. So if that joint visit is made, then we go to completing the inspection. And our inspection process is basically, it's a surface by surface, room by room test of every painted surface in the home. We are going to every single room and we are testing a wall, we are testing a window, we are testing a floor, we are testing a door, we are testing any painted surface that we find to try and determine if there is lead in that paint. We're also looking at the condition of that painted surface. Is it peeling? Is it flaking? Is it intact? So that lets us know whether or not there is or is not a hazard that is to be labeled there. So moving on. Once we complete that risk assessment, and again, I'm kind of going off to the left past that red box, once that assessment is completed, the lead risk assessor will prepare a report as well as a mitigation notice that is sent to both the homeowner as well as the property owner. I'm sorry, the property owner as well as the tenant. So the tenant, the property owner, we really try as much as possible to meet with them on site at the property to serve that mitigation notice. We prefer not to have to mail it. It allows us to be able to, one, ensure that they received it, because they do have to sign that they received it. And secondly, it allows us to go over where we found the lead hazards. So because sometimes those reports are not very easy to read, sometimes the mitigation notice is not very easy to understand, so that gives us the opportunity to go in and explain every single thing that is on there, and we make sure that they understand what needs to be done and what needs to be corrected, so that there is no question. They can't say that, you know, I didn't understand, I didn't get it. But if we are not able to get them on site, which happens on occasion, we will mail it. In addition to going over the mitigation notice with them, they are also given an application to our lead poisoning prevention grant program, and I'll go over that a little bit later. So let's see, I think that pretty much. So then we kind of enter into our mitigation process. So the owner has there are two ways that that mitigation would be done. Either the owner will correct on their own, and we supervise that process, or they can participate in our lead poison prevention grant program. So our grant program, there is an income qualification for that. And in the last 10 years, we've remediated about over 1,000 homes. And we pretty much run the program out of our own shop. We handle all of the application, we handle the oversight of the contractors, and we do the clearance and all of that. And in addition to us, we also have 3 grantees for 2016. We also provide grant funds to the City of Chicago, the City of Evanston, and the Village of Oak Park to also administer their own programs as well. So again, I apologize, another busy slide, but it's just a little easier to kind of do it this way. And also, I tried as much as possible to get those words back in the boxes. It just did not work, so I apologize, I really do. So, like I said, the homeowner has the option to either do the work themselves or they can apply for our grant program. If they do apply for our grant program and they are not approved, moving over to the right at the top, then again, they have to do the work themselves and we'll monitor that. Going straight down on the left, however, if they are approved, then our lead risk assessor will work with a general contractor that we contract with, as well as the property owner to develop work specifications. They'll do a walk through the property, look at where we found the lead hazards, and from that, our general contractor will generate work specifications. Those specifications are sent to us to approve. Sometimes on occasion they may miss a window, they may miss a door. So we will not approve them, we'll send them right back to them, say, you know, you need to revise these and get them back to us. So that's the no if we don't approve them. If we do, however, approve them, again, moving down, then we will forward them to, this says purchasing, but that has since changed. They now go to our lead poison prevention unit, Deanna staff, who will send them out for bidding to a contractor. And now I'm kind of moving to the left on the bottom. So once the bidding process has taken place and we have a lead abatement contractor assigned, again, our lead risk assessor, our general contractor, and the lead abatement contractor will go through and confirm everything that is on the work specifications. They'll make sure all the measurements are correct. They'll make sure that they understand what we're expecting them to do. So then that work is, again, that process is monitored by us. So once that work starts, our lead risk assessor and our general contractor will go out and perform just kind of a work in progress visit, just to make sure that the contractor is using the right materials, they are doing the work the right way, just so that we don't come back at the end and everything is wrong and we have to make them do everything all over again. So again, keep moving forward, at the bottom, once that work is done, and okay, this is kind of where the top box, where you have owner contractor to complete work, where the owner's doing the work, kind of drops down to the bottom as well. Once they are finished with that mitigation process, they will contact us and say, I'm ready for clearance, whether it's the owner that's doing the work or it's through our grant program. So again, our lead risk assessor, if it's just the owner, our lead risk assessor is the only one who's going to go out and clear that property. So they're going to go out, make sure, number one, all the work has been done. Secondly, it's been done correctly. And thirdly, they're going to take dust swipe samples. So those dust swipe samples are sent to the state lab, and they do have to meet certain standards in order to be considered clear of lead hazards. Coming down just a little bit further, if they are in our grant program, in addition to the lead risk assessor, the general contractor is also going out. The lead risk assessor is taking the dust wipe samples. The general contractor is looking at the quality of the work. He's making sure the windows open and close properly. He's making sure all the hardware has been installed properly. The correct materials have been used. And so if it's in our grant program, they have to pass both of those clearances, both the general contractor as well as our lead risk assessor. If they pass, going up on the right, yes, they pass clearance, then they get a certificate of compliance. We said that they're done, the property has been made lead-free, we're finished. If they do not, however, we start that whole process all over again. Now you have to do whatever work has been identified that you did not do properly the first time and contact us again when you're ready for clearance. So, there is sometimes noncompliance. Fortunately for us, it's kind of rare because we do have a grant program. Because we are able to provide some funds to assist, we typically are able to get compliance. For those that don't participate in the grant program, we still are able to get compliance, not as quickly as we would like to get compliance, but it does take a little bit of pushing and pulling and threatening, but eventually we are able to get them into compliance. For those that are just egregious and just refuse to talk to us, refuse to do the work, we do have the authority as agents to seek enforcement through the Cook County State's Attorney's Office. Fortunately, we don't really have to do this very often. It's been a number of years since we've had to send someone to the state's attorney. And these are classified as Class A misdemeanors if they do not do the work and they do not comply. And then if they don't follow the court order, it's a Class 4 felony for the first offense, then a Class 3 for the third, and they can receive fines up to $500,000 per violation. So it's really, it's pretty, pretty good incentive to do what you're supposed to do. So I'm going to just skip this and go back to it. So I want to talk about this first, as far as some changes in the administrative code. So about a year, maybe a little over a year ago, there were some changes to the Act, and the code is also being changed to bring it up to the level of the Act, that added that in addition to testing children, that we can also case manage pregnant women. And so in addition to that, our home visits for our nursing also changed. Our nurses used to go out when there was a child who was under 36 years of age and had a blood level of 10 or greater. If they were over 36, I'm sorry, they said 36, did I say 36 years? I'm sorry, I just realized I said that. 36 months and younger, and a blood level of 10, our nurses went out. If they have a blood level, I'm sorry, if they are older than 36 months of age, that blood level had to be at least a 20 or consecutive 15 to 19 tests. And so with the changes in the Act, our nurses are now going out on every single visit that the inspectors are going out on. Oh, I'm sorry, I was supposed to go back, wasn't I? Okay. So now they are required to go out for every single visit on a child who is 10 micrograms per deciliter or greater. So that was a significant change for our nursing department. Also, all of our visits are done by an RN. We do not have LPNs or just case managers. All of our children are seen by registered nurses. In addition to, so when they conduct their home visit, they're looking at nutritional, physical, behavior, and development assessments. They're also completing a healthy homes assessment. They're referring the children for any services that they think might be needed. And they're also coordinating with the doctors. They are contacting the doctors to make sure that the children are receiving their follow-up visits to get the testing. And so the nurse will follow that child until the child has at least 2 tests under 10. So as I stated, the lead risk assessor's client is the home. Once we are done with clearance, our case is closed, but that does not mean that our nursing is not still working on that particular case. They're going to follow that child until they have 2 consecutive tests under 10. And so some things that we are looking forward to is that, so what I mentioned earlier in the presentation regarding the state's attorney's office. So our state's attorney really do not want to have to prosecute people for lead hazards. I mean, they've got things like, murders and stuff to deal with, so they really don't want to have to deal with, lead cases. So one of the things that we are doing is we're working with our administrative hearings department to try and put together a lead poisoning prevention ordinance that allows us to prosecute these cases through our administrative hearings department. It takes a lot less time than trying to prosecute them through circuit court. And it gives us a little bit more flexibility in terms of the penalties and stuff. I mean, we don't want to, charge someone $5,000. I mean, we'd rather they put that money into the home and fix the problem. Another thing that we are working on is an RFP, a request for proposal from an entity to kind of farm out the lead abatement process. Right now, it takes our inspectors anywhere from 5 to 7 visits to a home just managing that mitigation process because of the lead abatement contractors. So we're looking to try and farm that out and try and give our lead risk assessors more time to work on follow-ups and getting properties to compliance as opposed to constantly monitoring the work of the lead abatement contractors. And then we also, I think Deanna mentioned this earlier, we're looking to pilot a program to test the water of homes where we just do not find any particular reason why this child's lead level is elevated. We haven't found any lead-based paint hazards. We've interviewed mom, and we can't identify anything else in the home. We've tested spices, we've tested makeups and everything, and nothing is coming back positive. So one of the things that we do want to look at that we have not done in the past is looking at the water. And that is it. Thank you.
I just feel, again, because of the limited time we have, I have to give a shout out to our speakers for covering so much in so little time. So I want to thank LaTrice for providing a very brief but detailed overview of remedies, mitigation strategies, both those being employed and also those being considered, which I think is important for both city, county, and other municipalities.